There you go. Sorry for our housekeeping folks. Zoom added a new little fancy logo and a new set of command things. And now that we have AI with Zoom, it's even more scary. Hello, Dr. Pinsky. How are you? So, people seem to be running behind for traffic today. Isn't that funny? Timmy is on his way to a doctor's appointment down in West Philly in the car right now, so will not be joining us. But I know he prepared with you all. So thank you very much. How are things going at Chester County Hospital?
I think things are going pretty well, actually. We're continuing to try to expand our services and solidify our employee satisfaction and our patient satisfaction so that we're serving our community.
You're doing a great job. So great to have this resource right here. And I know it takes a village and decades of work to make it work so well. So thank you. It's a relief to live in a place with such good, accessible healthcare and have great high opinions of everything. So
that is really a true statement. I mean, if you look around the country,
yeah.
it's there are many patients who do not have that advantage. There's no doubt about it.
Mm-hmm. Yeah, I just got back from a trek to the Grand Canyon and driving from Vegas through Route 66 through all that reservation land. There were some towns, I guess you'd call them towns, as we went through them. We had to try to look up when we could get service on what the heck was going on. Mm-hmm. One of the places that we were said, basically, if you get hurt, it takes about 7 hours to get help.
Wow.
Because it's in the middle of nowhere. There's only 3 EMTs who serve the area, and 2 of them also work for the fire company there, volunteers. So if there's a fire and you need an EMT, they're already down. Plus just to get transportation and by the time people can get there. So I told my nephew to hold on to the wheel very carefully. Yeah, but I couldn't even begin to imagine 8 hours, 7 hours just to get out if something happens at home, on the road, whatever. Yeah. Joyce, glad to see you. Things going well at Friends?
I'm doing well here. Thank you. Thank you. Yes, life is good.
Good. And LaToya, thank you for zooming in today. It's great to see you. And Cheryl, thank you. Cheryl, are you you're joining us from whoop, there you are. You kept moving around on my screen. From cats. Very good. And LaToya, do you dare be able to tell us where you're employed these days? I know you sent an email and I cannot remember who is lucky enough to have gotten you under their employ these days.
Sorry, I couldn't unmute and my AirPods aren't working, but yes, I'm working as a strategy director for Montgomery County. So that's where I'm at these days.
Excellent. Glad you've given your gifts to the world. This is beautiful. Yep. Let's give one more minute. I just had the bells ringing across the street, which seems a little late for me, but Reverend Dr. Rochelle Foreman-Gunter is coming on in.
Good afternoon, everybody.
Good afternoon.
Good afternoon.
So I saw some great clips of you dancing in Taylor music And did you know that Mike Duncan showed up at Taylor Music for our film shoot the other day too? We
I
did.
didn't know. Nice.
So we did a film shoot. Paige was there on Tuesday, about the forthcoming Declaration of Independence celebration, just 250 throughout the year 2026. We're trying to raise awareness. And I'm looking at the photos, and there's Mike Duncan in one of our cameo shots standing at Taylor Music Store. I think he was behind the counter. And then I look at another of the video shots, and there's Rochelle doing is it a minuet with one of the colonial revolutionaries.
Yes, one of the actors was teaching me the minuet.
He was, and Noah Lewis is his name. He
Yes.
actually he is a reenactor for what is the name? I'm thinking of the name of the reenactor. Oh my God, I am so blanking. That's sad. It is one of the only African American soldiers at the Battle of Brandywine.
Ned Hector.
Ned Hector. And he was the man who rescued our guns so the British couldn't get them. So yeah. So Rochelle, it's just too funny. I was like, what is going on there? That's a beautiful thing.
We had a lot of fun. It was good.
Yeah, you will see the video shoots all over pretty soon. Good, very good. Can we get started with this so that people are aware of people's times? So that if people zoom in on it, we can keep adding to it. And I have it on my screen, the handout that you sent, Dr. Pinsky, after working with Timmy on it. So can people see the screen? And we sent it out the other day, and we'll resend it again as well. So if you don't mind, let's get rolling.
Sure, I'm happy to kick it off, and obviously I have other teammates on the meeting as well who will introduce themselves as they go along.
Great.
This is always an honor and a pleasure to be invited back to the Idea Council, which we use as our community advisory board as we're working to prevent.
Oops.
No, you can actually go ahead. Yeah, by all means, yeah.
I lost your pictures, but I got the agenda. So yeah,
that's perfectly fine. Yeah, as we're looking to avoid preventable admissions in our community, but also address other areas where we think there may be some gaps between what the hospital is currently providing, what the healthcare community is currently providing, and what the community needs. So just a recap of our last meeting. We talked a little bit about building a workforce at Chester County Hospital that reflected our community and how important that was as we meet our other potential goals in terms of caring for patients who present to Chester County. We are going to talk a little bit about some other initiatives within our human resources department that we have engaged in since our last meeting. We're going to get just a one-slide update on how we're doing in terms of preventing admissions for a few key diagnoses. And then we're going to invite our community wellness colleagues, Michelle, Francis, and Rebecca Mountain, to talk a little bit about community outreach. And the community outreach we do is very broad, but it's geared in some cases specifically towards preventing admissions and unnecessary interactions with healthcare if avoidable. Then we're going to do a little discussion, and that's our favorite part, of course, is to ask the opinions of our community leaders around what we can be doing better. And then we'll discuss what we're going to do at our next meeting, which will be in 3 months on July 18th.
Right, thank you.
So we can go to the next slide. So I'm going to hand it over to Ed Callahan, who's our Chief Human Resources Officer. And Ed, take it away.
Thank you. As Dr. Pinsky mentioned, we've had a few initiatives around our employment. One of them is with the Chester County Economic Development Council. We received a grant from them to look at how we could impact social determinants for some of our employees, understanding that social determinants affect health. It also affects someone's ability to obtain and maintain employment. And so With this grant, we've had a couple of initiatives that have been started. We've started a Lyft rideshare program for employees who are having trouble with transportation to and from work. It was interesting, the day that I was set to meet with the Lyft team, we got an email from an employee that her car had been totaled, a nursing assistant, and she needed to get to and from work, and could we help her out? So a event of serendipity, I suppose, we were able to help her out, and have since helped out 2 other employees who have had transportation issues, and looking to see what that return on investment is for the organization over a period of time. In addition, we're currently working with our social work team to provide some sort of social work support for employees who may be having access issues for social determinants. So whether it's housing or other needs that aren't met, how can we connect them with some of the subject matter experts we have here in the organization to, again, ensure that they can maintain employment. Of course, the benefit being that that helps take care of our patients, but also helps take care of those employees who are members of the larger communities that we serve. With the technical schools, we have started conversations with the principal at the Technical College High School Brandywine campus, Dave Purdy. Myself and our Vice President of Operations, Shane Flickinger, are going to be meeting with Dave in May. We're actually going out to the school to talk about potential co-ops for next year. Really looking at areas like building trades, culinary arts, and potentially public safety. We already have some programs here where the health science students are here on campus and really immersed in a lot that we're already doing. So looking at those other areas to see if there's opportunity there for those students. The last is the podcast. Dr. Pinsky and I met with Liam and Eric, who I know were on the last call, to talk about really sharing this information to the broader community about how we're trying to impact the social determinants of health for employees, but also where we're looking to build some pipelines for groups that have been underserved or underrepresented in employment. And so we're excited about that. I think we have our recording in a week or so. It's my first time recording a podcast, so it'll be interesting to see how that turns out. But excited to share some of these initiatives and continue with this work as other community partners are interested in it. So.
Thanks, Ed. There'll be plenty of opportunity for discussion later. Though obviously, if anybody has questions or comments, feel free to raise your hand. I'm sure Karen's moderating and Paige is moderating. We can certainly invite you to contribute. I just wanted to thank Ed for making the comments that he did. And really, one of our commitments with these meetings, having our community advisory board be part of the Idea Council on a regular basis, is that we want to hear from you what your ideas are, and then we want to come back, the following session or perhaps 2 sessions later, and demonstrate that we've done some of what you advised us to do. So one of the suggestions was to really get more involved with technical schools, and we've done that, and certainly attending to the needs of our employees as it relates to things like transportation was something else we heard in the last meeting. And so I just want to just commend Ed for continuing to do the work and following up on the suggestions made by this group about 3 months ago. So our next session, or I'm sorry, our next item on the agenda is, I'm going to hand it over to Melissa, who I think is on there. I can't see her, but Melissa Spar, and she's going to talk just a little bit about some of the data that we continue to collect from the state in terms of preventing admissions that could be managed by patients and by providers in the community rather than at the hospital. Melissa?
Thanks, Karen. Thanks for having me, everybody. I think you all are aware that over the past few months, we did have an opportunity with the data from the state to do a better deep dive into some of these preventable admissions. And really related to their causes. And so Chester County Hospital, and we have a subset of disease teams that have been looking at this. We partnered with our community health resources to kind of understand what the contributing factors were. We really, we were able to look at admissions for COPD, diabetes, and heart failure because these were considered to be preventable. While we examined the circumstances contributing to these admissions and ED visits between them, there were some trends that really emerged. And you can see these trends kind of develop between the two maps. They're subtle, but it's over a 4-year time frame. So in the years between 2019 and 2022, we all know that Brandywine and Jennersville hospitals closed. And as you can see on the maps, the dots in these areas reflect preventable admissions. And they're getting brighter over this 4-year time frame, and specifically in the areas within the affected hospital closure areas. So I've circled them for everybody to kind of hone in on. So our deep dive of the causes surrounding our preventable admissions, we found that patients during the years of 2021 and 2020 lost access to care. More importantly, access to specialists such as endocrine, pulmonary, and cardiology. And to address access in these gaps, our community health team and our disease team coordinators partnered specifically for programs in these geographic areas. And to give an example, we had patients who were, for instance, living in the, deep southern Chester County region. One patient specifically who had diabetes, she arrived to our ER with a diabetic crisis, perhaps. And, we treated her for her diabetic crisis, but she hadn't seen an endocrinologist in a long period of time. And once we got her set up with that endocrinologist, she was able to then see them, but then her access to a PCP was lacking. And so really what we were finding was that they just didn't have the connections that they needed to maintain good health. And we found that through heart failure as well as COPD. And so the dots, though, like I said, are subtle. They're subtle changes in our community that are really kind of spiking up over this 4-year time frame with this loss of care in these areas. Karen, if I can segue for you, I'm going to hand it to Michelle and Rebecca Mountain to share what the community health partners are doing to kind of address the problems in these areas and the programs that we've really brought up and the progress of the programs.
Yeah, great. Thank you.
All right, I guess I'll take my next slide then, Karen, or whoever's driving. Well, Karen. Thank you. So I'm Michelle Francis. I'm the Director of Community Health and Wellness. Thank you very much for your time. As Karen said, we really do appreciate your input. I will say, just having been on some of the other 10 entity committees that are trying to create their own community advisory boards, I feel very fortunate that we have you on our team, because they are quite in fact struggling with this component of getting community input. And it's great to to be able to say, yes, we actually have an engaged group of people. So thank you very, very much. This slide, you'll see a couple things. It does say preventing. Oh, can you go back to the first slide, Karen? Thank you. This slide says preventing admissions. Although that is, the data that Melissa just shared about diabetes, heart failure, and COPD, some of the slides I have will represent not just preventing admissions in those diagnoses, but really will give insight to some of the programs that we are trying to do for the underserved, and to meet some of the needs of our community health implementation plan, that would include DEI initiatives. The QR code that's there, if you haven't already checked it out, it would take you to our wellness calendar of events, which you'll see goes well beyond the scope of this presentation, but I wanted you to be aware of all the programs that our community, that we do try to bring to our community, including mental health, which can obviously tie into all these diagnoses too, senior, women's health, all kinds of programs that are out there. So if you haven't taken advantage of our programs, we'd certainly welcome you, your family, your friends to attend some of our programs. Okay, now Karen. Thank you. So I will say, and I have said, that we really couldn't do what we do without our collaborations with our community or based organizations. We're so fortunate to have this. We are a very small team. When you say our community health outreach department, I mean, there's really like 3 of us with a couple per diem educators. So we really value the input from our community based organizations. So I'm not going to go over all these, but I just wanted to highlight, for example, community volunteers in medicine. They have an employee who does their diabetes education. Carla is her name. She actually works in our department per diem, and she's bilingual. So we work with them to bring Spanish programs to the community. And so, for example, last month, March was National Nutrition Month. We had 25 Spanish-speaking patients on a presentation in Spanish for them. And we do diabetes prevention programs as well. And then the Coatesville Faith-Based Coalition, I want to mention that because that's kind of in January, we formed this organization. We have some grant funding that we're utilizing that we proposed that we would get a group of Coatesville churches together and let them to tell us what they felt the needs are and what they wanted us to do. And we had funding for 2 projects, and we're doing a youth mental health toolkit. And we're hoping that will be actually out actually by Mental Health Month next month, May. And then we're also planning a community day in partnership with the Coatesville Youth Initiative on August 17th. But again, it's getting those church leaders involved, which has been really, really great for us. So the other ones, we if you go onto the website, we have our community health implementation plan that lists a plethora of other organizations, but these are the ones that we kind of are guiding us to help more along the lines of our DEI initiatives. Okay, next slide. Okay, so this slide represents just some of the things we've done, like literally within the last 3-4 months along the same idea. So we did, I'm not going to review all the things that are on here, but I think my goal is to kind of compare and contrast the heart tracks with our heart failure. And Rebecca is going to talk about the heart failure program, but the heart tracks program we ran on March 11th. It was in Coatesville. And I felt it was a very successful event. And just so you know, we actually had to cancel a scheduled heart tracks in Coatesville because we didn't get registration. So in January, we got a public health student who we engaged her in this project. And quite frankly, she made the difference for us between success. We got the volume and the demographics that we wanted. We had 33 people registered, 25 attended. 21 of the 25 were from Coatesville, which was the demographic we were targeting. And what worked was she literally went 3 days to CYWA's food distribution events and sat with the people, met with them, tried to get them to sign up. And then once they did, she actually registered them on site. And then once they did register, prior to the event, she would text them to remind them to show for their appointments because they had to have appointment times as well. And the participants did receive a $10 gift card for attending after they attended and provided us with a program evaluation. And we did pick up 10 as intermediate or high risk for a 10-year heart disease or stroke risk. So
wait, you did
I'm gonna turn it
a
over.
tremendous amount of outreach work to get 25 people to show up.
Yep.
That is
amazing.
huge.
Yeah, it is huge. And but like I said, it did make the difference.
And it's intensive to have a person at the food bank in Coatesville sitting down, getting to know people.
Yep, and it worked. So this will be part of our discussion, hopefully, like what else can we do? But I do want to kind of contrast this with the heart failure program, or let Rebecca, because we thought we had a really good idea how to capture a targeted group because of the deep dive into the zip code data that showed us that Coatesville was the main culprit in our heart failure admissions. So, but I'm going to turn it over to Rebecca, and she can share that story.
Thanks, Michelle. It's great to be here with you all. So, yeah, to echo what's already been said, we noted, well, I should explain, I spend a lot of time with heart failure patients as well as COPD patients, and trying, my work revolves around trying to keep them out of the hospital, making sure they have the knowledge and the things that they need to take care of themselves at home. And so as we had this influx of patients from elsewhere in the county, we noted that they hadn't been well educated on their disease management, and they had the lack of follow-up, and they also didn't necessarily have what they needed at home to take care of themselves. So for example, heart failure patients should weigh themselves daily. It's one of the ways that they could tell if they're retaining fluid. And so I noticed that this population that we were bringing into the fold was not well prepared to care for their heart failure at home. And when Michelle approached me with this idea of doing a program at Coatesville, I thought it was great. And we did target to publicize the event. We targeted patients who had been admitted to our hospital with heart failure in the 1 year prior. And so then some of them we had email addresses for, because I got them for another purpose while they were here. And some of them Michelle had to have her team look them up. So again, a lot of work. We targeted that group. We got 0 registrations for a program that was being held on Lincoln Highway, right in the middle of Coatesville, like sort of in the backyard, in walking distance for probably a lot of people. And so we didn't get any registrations. So then we sent it out to, I have a list of about 1,400 emails for people who have been hospitalized with heart failure, because we send them a newsletter if they're interested. So we used that list. We had a total of 7 people registered. We sent reminders out, flyers. We advertised that there would be a giveaway each week, something to help them in their care. And so there was a 3-week program. I did an overview the first week and talked about what is heart failure and what do you need to do to take care of it. The second week was a pharmacist talking about medications. And the third week was a dietitian talking about the low sodium diet and heart healthy diet, which is so important. And so we advertised that we're going to be giveaways. We had a drawing for a giveaway at the last week for anyone who attended all 3 weeks. So as I mentioned, 7 people registered, 5 attended. We had 2 that were no-shows throughout the time frame, and we did, remind them and tell them we missed them the first week. But as you can see from this photo, it's really not representative of the demographic in Coatesville. And none of these folks came from the Coatesville zip code. The closest was somebody from Thorndale, which is, 4 or 5 miles down the road. And we had somebody from Wyomissing, which I'm not even sure where that is, but I think it's way up north, maybe northern Chester County or close to Reading, perhaps. And some folks from southern Chester County. So they were all very appreciative of the information and the things that we were able to give them, but we couldn't get the target audience that we wanted.
By the way, the original email list that we sent out included 91
Thanks, Michelle.
patients who had been readmitted, or had been admitted from Coatesville zip only. So we got zip, not even like a thanks for the invitation, but I can't attend. Nothing.
So you can go to the next slide, right? And then we can talk a little bit about how we struggled.
Can you
Sorry,
see the next
I
slide?
myself. So, obviously we are having some challenges. We do have some great programs that we bring to the community, and even if we can impact 1 or 2 people, we feel good about that. But we're hoping that, again, through Ed's effort and HR's efforts, that we'll get more diverse staff here, that we can also bring them out to our community programs, because we have a hard time actually doing presentations in the Spanish community because of lack of clinical staff that can bring that forth. Registration attendance, to what we really just kind of spoke to, the time that it takes to get people registered and to get them to attend. And then the community grants, right now, we have done a lot in Coatesville because we've been fortunate to have some grants that are geared to be utilized for Coatesville health initiatives. but it makes it harder for us to bring programs to other areas in the county that we don't want to exclude. I mean, we do a lot of programs, as you can see on our wellness calendar, that they can access as well, but grants do help, especially with incentives and things like that. The silent environment, I've I've learned and I'm amazed how it's my goal is like, can we just break down these silos? And I'll just give you an example of that, what I mean by that. So we, as I shared with you, we created this faith-based coalition in Coatesville, and one of the projects was the mental health for the kids. So we actually met with the ACEs Coalition and the Suicide Prevention Task Force, and just to let them be aware that we're trying to do this thing, and we found out that they were already also in the process of creating a faith-based coalition in Coatesville. So it's like, okay, how can we work together? You know, so it's that constant, and the more you're out there, the more you talk, the more you find out. It's a constant thing. Wow, I can't believe I feel like people operate in silos. So how do we get rid of that? And then the ongoing relationships. And we're working on this. I mean, I don't expect things to happen overnight. It's going to take, I think we're becoming recognized, especially in Coatesville with the leaders and even some of the community members to gain their trust. And there's so many organizations, like how do we prioritize? Who do we go to? And we're great at sending flyers to all these organizations to help us promote, but we know it's going to take way more than just sending organizations flyers, because that obviously doesn't work. So how can we engage those leaders in our efforts as well? And then and maintaining relationships. I feel like a good example is, again, because there's so many organizations, it'll be like, oh, well, a year ago we were working with the NAACP in Westchester on XYZ. And we worked with the Spanish speaking church 2 years ago. But we haven't really engaged with them recently. It's kind of like, oh yeah, whatever happened to that group? Because it's not like we're not doing anything, but it's like, how do you maintain, not work in silos and maintain those relationships? Those are really kind of our challenges that we hope to bring forth in discussion and hear your input or thoughts if possible. Thank you.
Great. So the next slide really is just is taking what Michelle just said and putting it in question form, which is, identifying that, and I mean, really the Chester County Community Foundation is meant to be one of those conveners of community groups, right? Whether faith-based or otherwise. How do we use this idea council, the Chester County Community Foundation, or other venues to continue to promote some of this stuff, make sure that we're staying on the same page and working together instead of at cross purposes. But, the first question is just, a lot of effort, a lot of work, a lot of programmatic generating of programs, and then the registration and attendance is just a challenge. And so do folks on this call have any ideas for what we can do to make it more accessible? Even up to and including, going back to Ed, is it that we have to offer transportation? Do we have to offer to pick people up and drop them back off again? What does it look like to make these programs more accessible to our community?
Can you go
So
back to the
there's a couple of
relationship
things.
building that the intern did? And talk a little bit about that? A couple people zoomed in after. I'm sorry, Cheryl. Did you find the relationship building that the intern did made a huge difference just in one program? Or did you have them on more than one program?
She's has helped with several programs as far as just logistics and things like that. But I think this was the most impactful one, that it was clear. We canceled in November and here we are in March. Boom, it happened, and that we did, November was just traditional, send out the flyers. So I think having meeting the people where they are is critical. It's just hard for us to always be able to do that. And then I think we've had mixed with incentives, like to Rebecca's point, we had incentives every week for those participants, for the heart failure program, and that didn't seem to matter, so I think sometimes incentives help. was it the $10 gift card that they were gonna get when they showed up? Maybe because they're food insecure and they, the people that we targeted that for that program. But does that answer
Cheryl,
your
I
question,
cut you
Karen?
off. Yeah, Cheryl, what were your thoughts?
So I'm trying to figure out how to be able to say this. As I'm listening to you present, there's some things that are already triggering for me as to why it's not connecting. Okay. And just be mindful and just kind of bear with me. And I'm not going to try to take a lot of time, maybe. But when you talked about the culprit is Coatesville and the heart failure, whatever that was. Is it Coatesville or is it something else? What's the real problem? It's not Coatesville, but that language identifies people as a problem and not necessarily the system. Okay. And then a couple of times you refer to the people you were reaching at as they. Okay. So it's a they, us. It's not a community. All right. So in your presentation, it was already stirring stuff up in me, right? As to how you see yourself and how you in your mission to save the world. And I say that only because I've had a couple of conversations like, how can we help these people to be able to take better care of themselves? And just in that language to me is as a problem. The other thing is, it's not that the information isn't important, but it's very scary. If I'm hearing that I'm in heart failure, that stirs up a lot of stuff into me. So me coming into a workshop to hear about how scary it is, even though the information is going to be really good, is not going to really invite me, don't really trust the system, who are already thinking that you're already blaming us for our issues, right? To be able to engage, right? And then once you give me this information, right, what am I going to do with it? There's no resources, no supports, no whatever to help me be able to address it in the way in which you expect me to address it because you gave me that information. So maybe we need to take a look at what is it that really helps people to be healthy in their environment, in their community, and work from that place instead of from your space in, maybe from the other way out, to be able to engage them. And that doesn't necessarily mean it's going to be helpful, but it helps you to be able to have different language, to be able to communicate in a way that people can kind of resonate with it. And then I also heard that you said you have been working with groups and kind of maybe worked for a while and then kind of fell out. Did you go back to the group and find out what happened there? What was the reason? Why wasn't it that why all of a sudden it stopped? Who was it funding? Because a lot of times we know when you come into the community with all of these things, it's because of grants. It's not because of who we are. It's not because of what you do. It's not because of you care for us. It is because you have this resource. And mind you, don't be offensive because I'm saying that to care, but we know the only care happens because it's funding. When the funding goes, then you go, and then we're back in the same situation that we're in. That's why those are the things that if you don't think about, if you don't kind of explore and have conversations in them in those contexts, I think your impact is going to be less impactful. That's just my thought. That's just kind of what was triggering in me as I'm listening.
Thank you for sharing. I mean, I think I hear you and I hope I can apply some of the things that you're saying. So I think it is important in what you're saying. As you had a lot, so my mind's kind of swirling a little bit too. But as far as the organizations, I feel like I know we reach out to them just in the sense that we're sharing our programs for them to hopefully share. And I do know that we're going to be reaching out to the Spanish church again because we're going to do a mental health program in July. So we do try to circle back, but I guess in my mind, I don't think it's just because of funding. I really don't. It's more we get engaged in what we're engaged in and we're losing sight of it's like, it's hard to manage it all, I guess is how it feels for me. So I think, I feel like I need to invite these organizations to reach out to us too, because I'm very responsive. If someone reaches out to me, our team is very responsive. Our hospital is very responsive. So how do I welcome that, I guess?
And the last thing I'm
I
gonna
don't know
probably
if that
say
answers-
is
I'd
that
like to add, oh,
we
sorry.
just don't listen, right? I think we are in our own community don't listen, and those who come in to serve us don't listen to what the people are saying, and don't show that we listen, don't repeat that we listen and heard, and then we don't integrate it in what we heard. So I think that's the other piece of that.
I'm going to Joyce, then Rochelle, then Myra.
Yeah, I just wanted to kind of add on to what Cheryl talked about, particularly about being triggered. I think today more than ever, there's a distrust of the medical community. And one of the things that I really, as an individual who seeks medical care, I'm looking to see people of color, people that look like me, to tell me what's wrong with me. Particularly since the pandemic, I've even built my own, and I hate to say this, but I do have a general distrust of the medical, because I know, I think with being able to work in various committees and be involved with various groups, I'm always thinking about, okay, who is this person that I'm submitting my life to? Like, who is this person that is going to be offering me medical care, and how much do they really care about me as an individual, not coming from a specific group, but just as an individual, and how is what they're giving me pertinent to me as an individual and to my wellness. So I think I think it's almost like teachers, when students come to their class, they need to, for the students to be taught with any level of relevance and uniqueness, they have to be considered an individual person. I don't get that sense um, with medical information, medical content, medical service anymore. I feel like there's a prescribed thing, and that's the service you get. And I don't know how much of that is based on me being a woman, being a Black woman. I don't know. So I think that when you are presenting information, that level of understanding and that empathetic caring has to be obvious and prevalent to the audience that's being served. I hope that was clear. Please ask me questions if you need to.
It was clear, thank you.
Michelle, Reverend Doctor.
Hi, everybody. So it's fascinating, some of the things that you raised, because I was in a meeting this morning with Julie Miller about Chester County leaders reaching out on the mental health side. And how do we connect with community? And so this idea of silos is one that really resonated with me, because 2 hours ago, I was having this conversation on the mental health side, and now we're having this similar conversation on the physical health side. So I do think that there has to be a way to bring groups together and to create an economy that allows people to understand that it's not a one and done deal. It is not about a grant and then that effort goes away. It has to be, how do we create a relationship that stands without there being some incentive? I think that's one thing. The other thing is, as I've been listening to people who view themselves at a distance from the hospital, that were so invested in Brandywine reopening that they thought, that's where I'm going to get my care. And that didn't go through. And it's like, no, you really do want me to go into Westchester, which is not really my community. I go if I have to. I go when I have to go to the emergency room. I go as a last resort, which often is the lead up to the preventable hospitalization, but it's not my community. And I think that that's really important. I live in the area. I'm 5 minutes from the hospital. And so I see it very much as a part of my community. But for those who have to cross 202 or 30 or the bypass or 100 or Route 1, suddenly this is not my community. And so does it mean that we have to take services there? I think we have to consider it. But I think that people have to think about something that's offered close to where they live, in a place that they call home. So those are the things that I would offer. And I know that can really be hard, but the loss of Jennersville and the loss of Brandywine were real losses to those folks in community. And I don't know how we close that gap if there's not someone or some group identified to build relationships and keep those relationships going until things are different. And I'm going to stop talking because I could go on and on about this. But I think it's important.
Thank you.
Even with that, I think I think the audience, the service base has to be reflective of the community it's serving.
Yeah.
And when it's not, when it is, it helps to build more trust. And don't forget those. I will never, those numbers from the women's, the Chester County Fund for Women and Girls, they will forever be emblazoned in my brain about a congruence in medical staff and patient. When there is racial congruence, there is a better outcome.
Yeah.
And again, I go back to, I have never thought about that in my entire life. And now that I am this old, that is what I think about when I have to get medical service. The first thing I think about and this is just being very honest, open and frank. So I hope this doesn't disturb anybody. But when I see it, when I go to a doctor or when I go to a physician, when I go to get medical service, the first thing I try to assess is, does this person like Black people? Does this person like women? Because I need to know that in order to get the best service that I think I can, and not only the best service, but the best information that I can from this person so that I can get to where I need to be from a health situation. And I think that, I know that Chester County is not prolific in having a diversity of service providers, racially or otherwise. But I think that's something that really needs to be discussed.
I will say this brings forth, I think this is perfect timing. We're actually in the process of getting ready to do our next 3-year community health needs assessment, and they want to get focus groups together to talk about things exactly like this. So hope it's okay if I keep you guys in mind for when we're bringing those groups together as well. And I appreciate your honesty. We can't get anywhere unless you are honest with us. So thank you.
Well, and I would suggest, Michelle, I know focus groups, to hold them in the community-based organizations. Like I could see Joyce helping to bring together a focus group at Friends Association, or maybe at OIC, your old digs in Coatesville, and Cheryl at Kennett Area Community Services.
Be happy to.
Michelle at St. Paul's. I mean, Dolly at Delaware Valley. Violence prevention. So community-based focus groups to be hosted by members of the IDEA Council, so that you can help to bring people of color to safe spaces to talk.
Because that can I just share?
Oh,
I
and
just need to
Mara's
share
there
one more
too.
thing.
Yeah, I'm seeing, and Vivian, yeah. Yeah.
And that is that I was going to a dentist who was of Latin descent, he was Latinx descent. And he was a wonderful dentist, loved him, loved him, loved him. He died suddenly.
Mm.
I have not been able to go to another dentist since because there's so many things involved. You know, all of my life I've known my dentist has been either a practitioner of color or practitioner of color. And so now I don't have a dentist. And then my eye doctor retired. Now this was a person that was of not of color, but somebody that I've known for 35 years. I don't have another person that I feel, I mean, it's like a whole lot of vetting. So pretty much my eyes are just going to go bad until I have the courage to engage with somebody else. And I don't know that people think about that when we're looking for practitioners to work with, but all of that comes to bear and all of that comes to mind. So now I have no eyes, no teeth. And I'm trying to figure out a pathway to get back to the same level of trust that I had with the folks that I had. That's all I have to say. Thanks.
Oh, Joyce, go to Fern Hill Medical Center. The Fern Hill eye folks have a diverse cadre of folks, and I just got my cataracts replaced, by the way.
I heard they were good. I am going to check them out.
Yeah.
Thanks so much for that.
And my dentist is a wonderful Asian woman. So there.
Send me that name, please.
We will get your eyes and teeth, but you can see how that's the referral process and who do you trust over. And that's interesting that you bring up that at your age, all your providers are turning over. I do wonder the target age for the people you were trying to recruit to some of the groups and the whole distrust as I've lost my lifelong provider. Interesting. All right, Myra,
The
you
other thing
have
I'll
been,
say
yeah.
about that, Joyce, is thanks for sharing because access in general is a problem. I'm also responsible for the call center here at the hospital where people call and say, I need a primary care doctor for XYZ. And they're not saying the honest things like you just shared.
Right.
Just trying to get in. And it still might be, even without those things, it might be 6 months just to get into a care provider.
Exactly.
So,
Exactly.
Yeah, throw that
Yeah.
lens on, it brings a whole new dynamic, making it, yeah. So thank you for sharing that.
And Rebecca, I think you have a related comment. You can raise your hand like this too.
I know, I'm searching everywhere for raise hand in Zoom and I can't find it on my view. So it's interesting, I did a continuing ed on cultural competence last evening, and it was a webinar through my heart failure nursing professional organization, and the speaker was a woman of color, a nurse, and she spoke about, Joyce, what you said of, you know, people want someone who looks like them to take care of them. And that's not new. We've been hearing that, but it resonated with me, especially when you said it again. And then the other thing that she talked about, and I think we all hear this in the news annually, and I want to mention this as it relates to getting folks to come out and trust us and come to these things, is that nurses are generally trusted professionals. And that's something that you hear I hear it routinely. And I'm wondering what your perspective on that is. So if you could have a nurse of the same color trying to meet with people where they are and encourage them to take part in these programs that we would like to offer. I don't know how that would work.
I think I probably have an extra layer of scrutiny since I ran a certified nurse aid program for about 20 years. And I see the people that, some of the people that have gone through the program have become nurses, but I look at nurses in general and look at their lifestyle. I think I have a general trust of nurses because I think they do more hands-on work than the doctors, but there's still that layer of, yeah, what's their life really like when they're not here? I mean, I've known a lot of crazy nurses as well, like crazy. So I don't know. It's for me, I try to do a one-on-one assessment just to see. The other thing, just to see kind of what their belief system is. That's what I need to know. When I have a doctor, my doctor, for example, is a Christian. That's important to me. When I talk to her, we're talking from the same place. I think in general, there's a better distrust of nurses. For me, as I've gotten older, I'm just more discerning about who, because let's face it, when you work with a medical person, you're sharing things that you don't share with anybody else. They're seeing parts of your body that nobody else sees, that they know things about you that nobody else knows. And there has to be some kind, that's a relationship to me. There has to be some level of trust in order to get to that place. So it's not just, it's like you're going in a store buying a dress. You're undressing many parts of yourself that other people normally just don't, see from you. I think
I
other
think there's a
people should
level.
respond.
No, I think there's a level of transparency that you have with doctors and nurses that you don't have with other people. It's a level of intimacy that you don't necessarily have time to build to. You go in, you have something going on, and you need right now at that point to be transparent. And so you don't know that you are trusting, that you can even entrust that person with the information that you need to share. And so that adds to the anxiety of already having some kind of physical need. And I know that this is not new information, so I'm really curious what the hospital is doing to increase these numbers, because like Joyce and Cheryl, all my doctors are affiliated with Chester County and Penn Medicine, and I don't see it either. And this is not new information. This is not a new conversation. We're still not seeing the numbers change. And so in conversations that we're having with people who are just too frightened, we can't say it's better or it's improving or there's a plan. And so I think that those things are really important to understand what's happening at the hospital, to make it easier to trust.
Yeah, I think Joyce and Rochelle, I think your concerns and your priorities in seeking out a healthcare professional transcend multiple races, transcend multiple ethnicities, transcend multiple generations. And in listening to you, I know I speak to my own family members and they say the same things. And I think it transcends multiple, multiple gaps in even economic statuses, right? So what you're sharing, I think anybody would have concerns about too. And I think we have to really boil down what is the priority, right? And so that we can start chipping away at how we address those things. So as a healthcare organization, we can't boil the ocean all at once, right? So we have to decide, and we have to work as a community to say, what do we want to start looking at? And I think that's why we're here and working with all of you wonderful people to help us decide and unpack what is the priority. Do we look at race as a priority? Do we look at age in comparison to our own age as a priority? So if we're treating, patients that are, 60 and older, do we want to look at an older and seeking out older, providers so that we can have a more natural comparison, so that we have a more normal relationship? Or do we want to look at, more female providers so that our female patients have a more common ground to connect with. So I think that's what we're hoping to get out of this relationship with all of you, is what should we start chipping away at? What is the highest priority, so that we're not feeling together like we have to boil the ocean here? Because I think what you bring up are all very important and transcend, every piece of our economic area, and we have to start looking at all of it.
Myra, I know that you've had your hand up for quite a while and you have a viewpoint and ideas. Can you share?
Sure. So speaking from the Hispanic women, female perspective, but generally in the Hispanic. So you mentioned Coatesville. We were just talking this morning too about the growth of the Hispanic community in that Coatesville area. Housing being so expensive down here in Chester County, we have families that are living currently and families that are moving towards the Coatesville area and coming to work in Kennett in the Chester County area. And I'm from the migrant education program. We are housed under the Chester County Intermediate Unit, and I've been with the migrant education program for 1 year, but I've been in this community for about 30 years since I migrated to this country myself. And the reason why I started and moved back into working with the migrant education program is because I wanted to give back to my community. And there's been a change in the new migrant groups that came recently. And I felt that, having been a migrant myself and being bilingual and having navigated the way that I did and getting through education, getting my bachelor's, my master's, and becoming a career person, I had so much to offer to the new community that's coming, and to be relevant to them and to offer a helping hand, because I was offered so many helping hands in order to get to where I am now. Realizing that the recent migrant communities are different than the one I came with. So even in the Hispanic Latino community, we just had a conversation, thanks to Chester County Community Foundation, about Latinos and race and the diversity in us in the Latino, Hispanic, Latinx community. I come from Mexico. Things are different for us in Mexico than they are for people in Guatemala. One of the recent waves into the United States from South America since the pandemic. We have a growing community of families from Venezuela, a very different country, a very different community than the Mexican and the Guatemalan community, also growing community here in Chester County since the pandemic. And I just have to say, I'm very grateful to be in rooms like this. I'm very passionate about what I do, and I'm very grateful to be in rooms like this. And I thank the Chester County Community Foundation and caring for these opportunities, because it's been through them that I've been able to speak up and kind of move around and navigate all of these issues that are happening in this very moment. We have to look at history, but we also have to look at the very moment and what's happening here. So there are so many thoughts that I have, and I'm going to try to mull it down to like 2 minutes if I can. And so I shared a couple of links to give some solutions. So working with the migrant education program, we have connections in Coatesville through the Chester County Community Foundation and through CCIU. We have connections in Coatesville that we can try to collaborate more instead of working in these silos to create change that's going to be ongoing change, and it's not a one-time thing and that's it, we're done. Because I also hear what everybody else is saying. This has to be something that we can look at now, but also down the road, 10 years from now, 20 years from now, 30 years from now, and see progress. Because what I'm seeing in Chester County and in the nation in general is that there is a growing population that is retiring. And then there's new migrants that are coming into the country that are replacing those that are retiring. And we have to think about those migrants like myself and the new migrants that are here and have to grow and continue to grow in this country. And we are talking about shortages in education, shortages in teachers, shortages in nurses, shortages in doctors, all kinds of shortages because of the growing population that is retiring. What are we doing to promote those things that we have shortages in our incoming and growing communities, so that that is the solution for the future, so that in the future we have people that look like like us serving us, doctors serving us, nurses serving us, teachers serving us, the people that are in these communities and are going to continue to grow, because it's happening. No matter what we try to say or not say, it's happening. So in working with education, and I'm so lucky and so happy to be working in education, because I've always tried to focus back on that. If I was given an opportunity, thanks to education, to get my bachelor's and my master's degree and not have $80,000, $100,000, $150,000 in debt, even if I cannot afford housing in the Chester County area, I'm here and I'm hoping to stay here for a long time. I have an education that has meant so much to me that I try to put that in the perspective of everybody around me. Go get an education, whether it's a technical degree, whether you become a certified nurse or a nurse with a bachelor's and a master's degree. Become a doctor if you can. Sure, we need plumbers and we need construction workers and we need landscaping, but we need teachers and we need doctors and we need everybody that looks like me in every field, everywhere. So working with CCIU, I open my, my hand to speak, but I also say, come to me and I can put you in contact with whoever you need to in the Coatesville area with CCIU and the connections that we have there for the Hispanic community and for the Black community. Let's work together with Vivian at Westchester University to make sure that our students are going to the nursing track here in the technical college, but they're also following through at the community college, and they're also following through at Westchester University, and they're also following through to get to the highest degrees that they can get, to make sure that we have an even balance in all areas, so that come down the line when I get to 40 or 50 or 60 or 70 and I need to find a doctor that looks like me, I can find one, because it's a struggle. It's a real struggle trying to find a doctor that, as others have said, understands you, understands who you are, understands that, sure, I'll take a Tylenol, sure, I'll go and get chemotherapy, but what other options do I have in homegrown medicine, in healthy eating habits, something that I understand, but that not everybody in a low income family situation may understand, because it's easier and cheaper to give them a soda than to talk about healthy eating habits. It's a quick solution here and now, but down the road and down the line, what are we going to do to bring those healthier options to everybody, so that hearing about heart problems is not as scary as it seems in the perspective of people who are already dealing with so much more, and health is just an added scary circumstance, whether it's your day-to-day or, again, coming up with cancer, coming up with heart problems, heart failure, cholesterol, high cholesterol, diabetes, and all other things that are issue in our low income communities and in our communities of color. That's what I have to say.
Always good, Myra.
And
Yeah.
I do, like, I can definitely try to figure out within our nursing program if there's any space to be able to have students and teachers connect to serve the community that they need to serve. So yes, absolutely. Let me know. My email is very rarely available to reach out, and then I can see who I can need to connect you to at Westchester University.
Kind of my thoughts, and thank you, Myra, for sharing, because I've identified with a lot of what you're saying, but that I think developing that pipeline into the health system is so important, right? You have Westchester, you have Lincoln, and you have Cheney, and developing those relationships to be able to develop the pipeline into your institutions is going to be really significant. But I think the other piece of this is You need to have people of color as a part of their training and education. Otherwise, you may be continuing some of the miseducation that may be happening in the institutions that you have. So, that had been a thought for me for health as well as for social service, is that we're missing opportunities for, we talk about we can't find folks, they're not out there, but we also not helping to create that. And I think you have the resources within your system to develop that relationship for those things to happen.
Dr. Pinsky, you have enough ideas for a few moments and know where to follow up for more advocates throughout the community?
Yes, very much so. So I wanted to say one thing, which is nobody ever has to refrain from being honest, and brutally honest, and thought-provoking, or perhaps even controversial. I think that that's exactly what this Idea Council and our desire is to hear what you're thinking, what you feel, how we can do better. So thank you for that, and don't ever refrain. A couple of just updates I wanted to offer. So Penn Medicine will not be developing the old Brandywine Hospital campus. I think that news is certainly been circulated. There's some kind of, I'm not a geologist, but there's some kind of pipeline or something underneath the hospital that would not allow the development of the campus the way that they had hoped to do so. There is still a desire to work with the VA in Coatesville to develop another hospital at another site, but within the range of course, somebody had forgot whom, but said something about crossing 30 and 100 and 202 within that specific area. So there's still that desire to go ahead and do that. I have no specific plans. I don't specifically know where, but the only thing that's been abandoned, to my knowledge, is that Penn Medicine won't be developing the actual old Brandywine site, but there's still an interest in doing more. The other thing that I want to offer in terms of pipeline and growing a workforce that looks like our community is there is an interest in from Kevin Mahoney on down to develop a residency program, so a family medicine residency program at Chester County. And the reason for doing that is this very thing, which is how do we, with using the hospital resources that we have, invite young trainees to come, ideally young trainees who look like the folks in our community, and then have them stay in the community. So a lot of trouble, I shouldn't say a lot of trouble, but a lot of the strain that occurs in the medical community is that we have young trainees, they train, and then they tend to go live in places that don't necessarily always look like them. And so we really want to make sure that we're trying to attract and train and then keep, that's the key word here, is keep our young physicians in our community. And I think we can do that if we structure the residency the right way. So those are two things that I think, not tomorrow, but they're on the horizon and they're very promising, and I wanted to report to the group.
And Dr. Pinsky, just to add to that, I did not share because it's very preliminary, but I've spoken to our chief nursing officer about potentially doing some scholarship programs for underrepresented groups in nursing, trying to partner with some high schools and local universities. There seems to be some funding left over from the School of Nursing that is a bit restricted, but that could fall into that sort of scope. So more to come, but I'll certainly be reaching out to many on this call to try to work through some of the logistics of that.
That's good news on both counts, on all counts. You can bring this topic up whenever you need to, it looks like, Dr. Pinsky.
Well,
and
it's
even more. Yeah. I want to be cognizant of our time. It's almost 1:15. And this is not over. It's just that the end of our session is done. You have everybody's contact information. And if you want to follow up, please, I think people say feel free, and let's continue this. And you are doing incredible work at Chester County Hospital. And I think the affiliation with Penn in Philadelphia brings some incredible strengths that we need to get out to Chester County even more so. So thank you for everything,
Thank you
for having the courage to have our Idea Council speak our minds. More to come whenever you want.
It's refreshing. Thank you all.
Thank you.
Okay.
Thank you,
you.
everybody. Keep healthy. Joyce, let me know when you want that dentist. Go to
I
Fern's
sure
office,
will.
go for the eyes. Thank you.
I've been brushing a little extra.
Yeah,
and
well,
flossing
now you
too.
can't do it enough. Yeah, nice try though.
Thank
Everybody,
you.
be well.
Thank
all right?
you.
Stay healthy. Thank you for everything you're doing.
Thanks, everyone. Have a
Thank
great
you.
rest of your
Bye-bye.
day.
Thanks,
Bye.
Bye-bye. Okay, there you are.
All
Thank you.
right. Just stop